Riley Hospital for Children is nationally known as a pediatric care center that's been servicing families for decades. And now they're known also for something new, some innovation that some dedicated physicians have brought forward for kids. And it is the first hospital in the state to offer an innovative, less invasive pre-surgical treatment for babies born with a cleft lip. And so here to tell us more about this new treatment is this lovely lady who also happens to be from Fort Wayne. We found out during the commercial. We're both from Allen County. This is Dr. Laquia Walker-Vinson, who is a pediatric dentist. So thanks so much for coming.
Thank you for having me.
Yeah, so let's talk first of all about what this issue is and why it's challenging to treat, and what's the new option that you're doing.
So craniofacial differences affect approximately 1 in 600 live births worldwide and about 1 in 1,000 births in the United States. And so ultimately, we want to be able to correct those tissues that did not fuse together prenatally. So what we do is use pre-surgical interventions to help. So in the end, plastic surgeons are able to do their best work when they correct those differences.
Yeah, so like if you have a split here, like between like your nose and your lip, and this is something that you can do in advance to kind of help narrow that gap.
Yes.
Explain that.
Yes, and so the product that we use is called Plana, which is pre-surgical lip and nose approximation. So what it does is help to bring the lips together in a more ideal position and also elevate the nose as well. Typically with a unilateral cleft lip and palate, one side of the nose is flattened. So we want to make sure that is even. So when the plastic surgeon does their surgery, they have it in that ideal position.
Yes, and so you brought some product here to just kind of show. I mean, it's amazing to me when you think of this as like a little brace, and it looks almost like a little piece of tape almost that you put there, that it could have that much of an impact for improving the outcome for these young patients.
It really does. I tell the families when they come into the visit, I know this is a lot to see your newborn like this, but trust me, in 12 weeks, you are going to be so happy with the result and what we're able to do with something so simple.
Right, and so much of this too is so important for young people, right? Because if there's something that's disfiguring on your face, that can have a big emotional and mental impact.
It can, and so by doing something early and intervening early, if we can get things as ideal as possible, then the plastic surgeons can do their best work. And so you don't see those little aesthetic changes that sometimes cause people to unfortunately be bullied.
Well, and it's hard on families when they have a child that's born, you know, with something that needs attention, all these trips back and forth to the doctor and trying to find a fix, but this also helps minimize all those trips.
It does. Past interventions, parents would have to visit facilities weekly for adjustments. Now we are able to decrease that amount of travel time, that time away from home and their families. Mm-hmm. So we're seeing them every 2 to 4 weeks instead of weekly.
Oh my gosh, that makes such a big difference. So when we're talking about cost, is this something that, you know, we were talking about, you know, surgery, that's very expensive. But for something like this, it seems pretty simple.
This definitely decreases the cost impacted by families. So previous treatments were easily 4 times as much as what this intervention is.
Yeah, sometimes it's like we overthink it, doesn't it? It's like a simple solution.
Simple solution.
Yeah, so thanks so much, Dr. Walker-Vinson, for joining us, and it's good to see you.
Thank you.
Allen County lady, look at her. She's a big old doctor here at IU Health, coming in and being our expert today. I appreciate that. And really, it's all about spreading the word for families to know that these options are available. So certainly if you don't hear this and you're in this situation, make sure you ask the right questions.